I did a video recently about a drug called Ilaris. It was found by the CANTOS trials to actually prevent heart attack, stroke, and even cancers. Here's one of the problems. There's got to be a problem, right? One of them is it costs $200,000 a year. So this is Ford Brewer with PrevMed, heart attack, stroke, cancer prevention, disability prevention. And this is about the economics of Ilaris. Ilaris is a drug that was found to be, it really does. It truly prevents heart attack, stroke. They gave it to a few thousand, I think about 10,000 people across the world that had already had one heart attack and stroke. These people are at risk for a new one. Significant risk for a new one over the next 5 years. They gave them this drug and prevented heart attack and stroke type of events. So, what was Novartis? Novartis was the maker, by the way. And I think you may be able to guess their reaction. They said, oh, this worked. It decreased heart attack and stroke. And guess what? We're going to go meet with the regulators. Well, what does that mean? In pharma speak, that means we're going to go get an indication for heart attack and stroke. Ilaris has been somewhat of an orphan drug, meaning the diseases that it was used to treat are diseases that would be orphans, meaning they're so rare that there wasn't enough economic reason to develop the drug. That whole orphan drug thing was developed by the U.S. Feds to help people get funding, help the pharma industry make more money, as if they needed it. Anyway, so guess what? Heart attacks, strokes, and cancer are not orphan diseases. They are not rare. So big business magazines, for example, Forbes, is taking a look at this and they're saying, whoa, $200,000 a year to prevent a heart attack and stroke. What's the financial implications here? Well, they're starting to get a little bit more realistic, and they're starting to say, well, instead of giving it monthly, a monthly injection like you do with the inflammatory diseases, the arthritis, the other inflammatory diseases that it's currently used for, the trial with CANTOS used it every 3 months. So divide that 200,000 by 3 and you get somewhere around maybe 60,000 per year. Well, is that realistic? Now think about it. We've actually got we've already been down this path, at least in terms of the economics and finance. That's with the PCSK9s. Again, sorry about the big word. That's the simplest term we have for that drug. The PCSK9s are new drugs which really have a significant impact on our cholesterol values. Even Forbes mentioned that. And actually, it was mentioned in the CANTOS press releases that CANTOS appears to decrease heart attack and stroke maybe about as much as the PCSK9s. Now, they cost $14,000 per year. Guess what? The insurance companies, the payers, are very hesitant to pay $14,000 a year, even to prevent a heart attack and stroke. That's also not a big surprise. The insurance companies have been able to negotiate with Amgen, the maker, a decreased price for $9,000, and even more so, a guarantee that it's going to work. So evidently, for the typical insurance company contract with Amgen for the PCSK9 Repatha, if the patient's taking the Repatha and they have a heart attack, then the insurance company doesn't have to pay for it. So all of that, pardon the graphics. All of that raises some significant questions, but I'm not even going any deeper into those questions. I'm going back to the clinical issues. A lot of people have seen this article. It's showing inflammation's role in diseases. It's from Scientific American, a good magazine, and this is their illustration of CRP, C-reactive protein. Why are they not talking about this is the cure for heart attack and stroke? What is the real significance of this issue, this drug, the CANTOS trials, which have shown that this drug decreases heart attack and stroke? Well, how do you spell validation, vindication even? A lot more than just support for folks like this fellow right here, the principal investigator of the CANTOS trial. His name is Paul Ridker. Again, I mentioned him in the other study. He and a friend at Brigham and Women's in Harvard 20 years ago noticed that when patients were taking statins, even if it didn't decrease their cholesterol values, for some reason it tended to prevent a heart attack and stroke. They theorized at that point that it's not just the plaque. It's what our body does with the plaque. Now, maybe we could show that in a picture format, and I've shown this series of pictures many times. This is an artery, a healthy artery. There are two layers of the artery wall that we want to look at. One is the intima, one is the media. That's the muscle layer which provides structure. The intima makes it slick on the inside and keeps it from clotting and other metabolic activities like this. But what does this look like in a real human body? This is a patient that died of a heart attack. And this is plaque. This is the intima layer that I showed a minute ago. You can see it's very narrow, about a cell thick in this area. It's a very narrow layer, not just in this area, but you can see it there in this area because of that liquid spot. This is the media, the muscle layer of the artery, and all of this in between is plaque. So plaque doesn't really pile up inside the artery, it piles up in the wall of the artery, and this is a waxy brownish substance. As I mentioned a minute ago, this is a liquid. In this higher resolution, you can see this is an area of this waxy substance that has been turned into a liquid. That is inflammation. This patient's immune system recognized this this brownish waxy stuff and said, hey, I don't want that stuff in there. I'm going to send in white cells, immune cells, antibodies, and attack it. And I'll digest it. As it digested that waxy substance, it turned it into this liquid. Here's the problem. It's not the plaque that kills you, it's the clot. And if this stuff leaks out, we call it hot plaque inflammation. If it leaks back through here, it causes a clot. The vast majority, as in 90% or more, of heart attacks and strokes occur in arteries that were patent. They were open 1 minute before it happened. Here's another real-life picture. This is from another patient that died of a heart attack. And here you can see, you can't see the layers quite as well, but you can see this. This is the intima layer, that very narrow lining. And as I mentioned before, you can get cracks in this area, and inflamed, hot, liquid plaque can leak through that crack. If it does, you can get a clot. So, this black stuff right here is not liquid plaque, it's the clot. So you had cracks in the intima layer, you had hot plaque here, liquid. That liquid flowed through the cracks, formed a large clot. The vast majority of this large clot floated down, and that part that floated down is what killed the patient. So again, this was major significant news clearly, it's true. It's a way to prevent heart attack and stroke with a medication. And it works. And it's expensive, $200,000. They think they'll get it less. But I'm not using it yet. Why? Well, here's why. In the studies, the overall mortality rate was not improved. And here is what happened. You had a trade-off. Yes, you prevented heart attacks and strokes, those type of cardiovascular events. But you also, for every one of those life you saved, it appeared that you traded off for another life, a person who died due to significant serious infection. So this is a very serious, very powerful anti-inflammatory drug. It's used to basically cripple the immune system. Well, you can get good and bad. It's like they say, there's always something. You get the good of slowing down the immune system and stopping its negative impact on plaque, and therefore heart attack and stroke. But for every life saved by doing that, you had a life lost by serious infection. We're not quite ready for prime time, but it's very interesting information.